Because I'm an orthopedic surgeon who is fellowship trained in sports medicine, I think I'm uniquely able to treat a wide range of patients. I'm comfortable taking on everybody from the younger athlete who has a meniscus tear or an ACL tear to the older patient who may have a rotator cuff injury, ultimately to someone who may have developed arthritis over decades and needs like a shoulder replacement or a knee replacement. I understand that not every patient is a professional athlete, but at the same time, they could be an avid recreational athlete or they could have work or lifestyle demands of very high function. I find it very rewarding when they leave my clinic and they feel better or they have a sense of, hey, I know where this is going. I know how I can resolve this situation, or I know that they feel confident that they can get back to their normal life and their lifestyle and to kind of improve their quality of life.